My whole family was athletic, and I have 4 brothers who actually played professional athletics. 3 of them have had concussions to different extents. I think watching them struggle has led me to never want a family or a family member or a community member to ever have to go through that on their own.
Concussions are very different from what most people think. Everybody recognizes that concussions and sports go hand in hand. But what people don't always recognize is that concussions can start very early on when kids are infants, and they go all the way up through our elderly seniors.
Concussions are different from other injuries just because we're not quite sure the magnitude and the longevity of the consequences of concussions, whereas if they have a contusion or a torn ACL, we have an idea of what their long-term outcome is going to be.
You do not indeed have to hit your head to have a concussion. All you need to do is have your brain jolt inside your skull, and you can have a concussion.
Parents and schools can play a pivotal role in detecting concussions. Parents are going to be more in tune with their child's behavior, and schools can help play a big role by helping promote awareness by having information of signs and symptoms to look for in a concussion.
Working with the coaches in the athletic community has been both interesting and challenging. There are though still some of the old school mindset people, what they haven't quite recognized the significant importance of what a concussion is and what a concussion can mean if it's not properly treated before a player returns. We are attempting to bridge this gap by arming our community so that they know what is it that they're looking for, and putting the onus on them, not just how do I protect myself, but how are you responsible for protecting your fellow athletes.
Some of the major challenges that we see in treating and evaluating concussions in a primary care setting are being sure that everybody's aware of the current guidelines.
Minnesota's hospitals aim to provide consistent concussion treatment from the hospital to the sidelines.
We're developing standards of care. We're developing procedures and algorithms to help providers determine if someone's had a brain injury and then how to treat that brain injury. We felt it was really important to start educating both the community and the providers on the treatment and how to recognize the symptoms of concussions so that no one would be missed, hopefully, in the future.